Hey, Medicare Mike here, running through Medicare Advantage versus Medicare Supplement, which for most people is the biggest decision they're going to make around what type of Medicare coverage to get. So with that, let's talk about the key differences. We're going to start with Medicare Advantage, and first thing to know is that this is probably something that you've seen advertised before, especially on TV. It's that $0 all-in-one Medicare plan. Normally when we see that, they're talking about a Medicare Advantage. So here's how it actually works. First thing you need to know, it's not a supplement. I say that because it doesn't work with Medicare, it works instead of Medicare. So what I mean by that is with normal Medicare, traditional Medicare, you have, for example, for the hospital, about a $1,400 deductible that you'd have to pay before Medicare pays anything. Now with the Medicare Advantage, it replaces how you do that. So instead you pay a daily copay. On average, it's about $300 per day, each day for a full week. So if you go to the hospital for 2 days, $300 a day times 2, $600, that's a win compared to the $1,400. But if you're in there a week, that's 300 times 7, you're up over $2,000. You've just spent more than you would have otherwise. So that's one of the examples where it replaces how you get your coverage, because you still have a bill for everything that you do. The other thing you need to know is that there are network restrictions. So there's only certain doctors and hospitals that you can go see, or the plan might not pay anything at all, and you have to pay that entire bill yourself. Good thing about Medicare Advantage is that they do include a maximum out of pocket. Original Medicare by itself does not have that. So your exposure of that 20% that you have to pay, there's no limit to it. However big it is, you have to pay 20%. Medicare Advantage is going to cap you. So the most you're going to have to pay in a year is set by the insurance company. And then if you hit that, they'll kick in, they'll pay 100% for the rest of the year. Varies by plan how much that is, but a common amount is about $6,700 each year. Last thing about the Advantage plans is that most of them include prescription drug coverage. It's included. It's not something that you can tailor, so you get whatever's built in, which means it can be a great option because you're not paying anything extra for it, but you also get whatever is included. You don't get to tailor your drug plan to your specific needs. So for Medicare supplements now, you're going to pay an additional premium. Varies by company and the area you're in, but normally you're going to be looking at between $100 and $140 a month. Now what you're going to get for that is it's going to help pay what Medicare doesn't pay. So that $1,400 deductible that you'd have to pay going to the hospital if you just had original Medicare, it's going to pay that for you. And it's a unique one because it's a per occurrence. So whether you go to the hospital once, 3 times, or however many, it's going to pay that for you every time. So if you go to the hospital, you pay 0. If you're having something like knee replacement done, basically Medicare is going to cover 80%, the supplement is going to cover 20%, and you would pay 0. So it's nice. The other perk is that you get the flexibility to go see any doctor, any hospital nationwide. There's no networks, no referrals, no restrictions. You just go. And then the predictability of you pay that monthly premium, and if you need to use it, you don't have to figure out a way to come up with paying a major bill because you don't have any. You don't have any major bills between Medicare, Medicare Supplement. It's very comprehensive coverage. A couple key things you need to know about the drug coverage is that it does not include it, the supplement. Like the Advantage does, the supplement does not. So you get a standalone drug plan. The perk of that is that you get to look at the drug plan by itself, compare the options, which I'll help you with, to find the plan that's going to cover your medications at your pharmacy at the lowest total cost versus just having the one that's built into the medical plan. As you're starting Medicare, a couple key things you need to know is that when you first start, you have a 6-month window where you'll be approved for a Medicare supplement from any insurance company that you want. This is the one time that happens. If you choose an Advantage plan when you're first starting Medicare and you decide you later want to upgrade to a supplement, you'll have to pass an underwriting review, which means the insurance company is going to look at your health history, ask you some health questions, and then decide do they want to accept you, charge you a higher price, or maybe not offer you coverage at all? Now, if you choose a supplement and you decide later down the road, I want to go to an Advantage plan, lower that monthly premium, that's something that you can do, no health questions, very easy. So this is your big question. What's more appealing to you, Medicare Advantage or Medicare Supplement? Once you make that choice, it becomes much easier to narrow down the options, start looking at companies and see what's going to be the fit for you. Whether you're still trying to decide or you've already decided what route you want to take and now you're looking at companies, either way, I'll be happy to help you out with Advantage, Medicare Supplement, or prescription drug plans. Here's how you can reach me. Again, Medicare Mike. My name's Mike Lovell. Been licensed since 2009, specializing in Medicare a long time. 608-571-4461 or toll free 855-712-7316.